Now, in terms of other data, we have some slides that I'd like to call up now, please. So we have been able to expand our understanding of testing in Shelby County, and we are beginning to report that information, that broader understanding of testing volumes. And what you see here on this slide is a representation in the first column, the number of people who have been tested, either positive or negative. And we have, as I've reported, 29,797 people who have tested positive in Shelby County. Now you also see in the right column the number of tests. And so some people have been tested more than once. And in total, we've actually had 413,586 different tests reported to us from March through yesterday in Shelby County residents. And the 2 points that I'd like to make about that are, when you calculate it, that represents more than 28% of the population has been tested at least one time, and there are some people who have been tested several times. And that points us once again to the fact that in Shelby County we have widespread availability of testing, and in fact we have over 10,000 community-supported test slots available, appointments in community sites for people to come in to be tested. And so there is good access to testing. Many of our citizens are taking advantage of those testing opportunities, and we would encourage everyone, if you are having symptoms of COVID-19 disease, or if you've been exposed to somebody, you're a contact to a case and you want to see whether you have become infected, because people can be infected without showing symptoms, that we want to remind you that testing is available and that plenty of your neighbors have taken advantage of that opportunity, and we would encourage you to do so as well. In terms of other statistical things that we want to cover today, I want to point out that the distribution of our cases has had a disproportionate impact on our minority populations. So we've seen that throughout the entire epidemic, but we are over 79% of our cases have been diagnosed among people who are either African American or Black or Latino, part of the Latinx community. And because this is Hispanic Heritage Month, we will be offering an enhanced number of opportunities and outreach testing events to our Latinx community, and those will be highlighted once again later in the briefing. In the next slide, please. We see that our children are also represented here. Overall, 9.5, or about 10% of the cases that have been diagnosed are pediatric cases, meaning they're less than 18 years of age. But once again, our minority populations are bearing a disproportionate share of cases among children. So in the testing events this Saturday and Sunday, we are offering testing to people, anyone 13 years of age and older. And so we certainly would encourage any of our school-age children in middle school or high school who need to be tested, that they certainly could come out and be tested in the test events this weekend. Now, in terms of our deaths, we continue to see that certain risk factors have increased a risk of death. And there are 5 that we have mentioned repeatedly, and I want to call your attention to them again. If you're 55 years of age or older, that in and of itself increases a risk of death. Also, if you're obese, if you have diabetes, if you have an underlying respiratory condition such as COPD, emphysema, asthma, or any other lung-damaging disease, that all increases your risk of death. And the most important increased risk factor for mortality is heart conditions. That includes even having high blood pressure. So if you're on maintenance meds for high blood pressure, or you have ever been recommended to be on maintenance meds for high blood pressure, you're at an increased risk for mortality. Also, if you have been diagnosed with heart disease of any kind or any sort of cardiac condition, that is an elevating risk factor. And that means that if you were to acquire COVID-19 disease, that your risk of death from it would be greater. So for all these reasons, we would encourage all of us, with over half of our cases being less than 54 years of age, and over half of our deaths being more than 55 years of age, we would say everyone in the community has reasons to follow the precautions that we outline. Social distancing, wear a mask, hand washing, and avoiding being around large groups of people where it's easier to transmit the virus. All of those control measures remain to be important across the entire community. And lastly, I will mention, just because it is of great media interest and we've had questions, I can expect that there will be more questions today. We are working with the University of Memphis to investigate clusters and cases at the University of Memphis. And as of this moment in time, we've been notified by the university of 135 students who have tested positive in August and September. And that does include the students who were part of the athletic teams, but it also includes others. And we continue to work with the university and with those students and with faculty and staff associated with the university to investigate cases, place those who need to be under control measures of isolation into isolation, place those who need to be in quarantine because of exposure in quarantine, and continue to work to bring the transmission associated with the University of Memphis under control.